Are you ready for that party?
I know, I'm so excited.
Oh my god, it's gonna be so much fun.
Yes.
Oh my god, Dylan, you're bleeding!
Oh my god, no one.
Hemophilia is a clotting disorder that begins as a genetic defect to the X chromosome. This disorder can either be inherited or resulted from a gene mutation. Hemophilia causes individuals to bleed for a long time before the clotting process occurs. Depending on the severity of hemophilia in an affected individual, this person may experience uncontrollable bleeding with no knowledge of this event. There are two types. Hemophilia A, it is missing the factor 8 in the clotting process. Hemophilia B, it is missing the factor 9 in the clotting process. Oh my god, are you okay?
Oh my god, Dylan, he's not responding. I can't get him to respond. Dylan!
You okay? We should just call 911.
Yeah.
Let's do it.
Call it.
Let's go.
What happened? How did I get? Who are you?
I'm Dr. Zaduk. You're in the hospital. You fainted from uncontrollable bleeding.
Well, how did I get? Why? How did I get that?
You got it from, it's like a blood clotting disease. It's hemophilia.
Well, how did I get that?
Dr. Griffith?
You got it from your mother or father. It can be carried from your mother to you if she's a carrier of this disease, or it can be passed down from your father to you if he also has hemophilia. Does that make sense to you? Do you get it?
So you're saying my parents gave this to me?
Yes.
So I couldn't stop bleeding?
Yes.
No. Yes, you couldn't stop bleeding. That's why you fainted.
Why? What do you mean I fainted?
Because your blood wouldn't stop. Because you wouldn't stop bleeding, you lost enough blood and you got so freaked out that you fainted.
Yeah, but why wouldn't I stop bleeding for?
Because hemophilia is when you're missing either part 8 or part 9 of the blood clotting process, which makes it slower for your blood to clot. So it sends the message slower. Does that make sense?
You get it? Your
Yeah.
parents did this to you.
My parents did this to me.
Yes, your parents. They made you faint technically.
So this is my parents' fault.
Yes,
Yeah.
it's your parents' fault.
I didn't faint. Guys can't faint.
I'm sorry, bud. Guys do faint.
So, when can I get out of here, Doc? I got guy things to do and girls to smooch and whatnot.
You should only be here another few days.
A
We're
few
just kind of
days.
trying-
I gotta be. You did this to me. It was all your fault. I'm in here and I'm bleeding to death. I could have died because of you. All because your stupid, messed up genes is all you. Get away from me,
Guys! Calm down. Your son has inherited hemophilia from either you or your husband. You could potentially be a carrier.
See, I told you it was all your fault.
Calm down. You know that hemophilia causes uncontrollable bleeding. We've already discussed this. You know what happens. You know how it works. So don't freak out on your mom.
So, am I the only one affected with this, or
It's only guys. Only guys are affected by this.
So you're saying if I was a girl, I wouldn't be bleeding to death here? I'd be perfectly fine and normal and happy and all jolly?
Yes.
Well, yes and no, if you think about it. Because if you were a girl, there would still be a chance that you were a carrier and that you could pass this down to your children.
So my kids would be permanently messed up and bombed, and their grandkids, my whole family, and they would have this.
No, they wouldn't be messed up. It's not messed up.
It's not-
just hemophilia.
It's just blood.
It's just blood. They won't be messed up. They won't be physically hurting for their whole lives.
But
just
I'm
bleed.
hurting. I'm hurting right here. My arm hurts. Okay? It hurts. My soul's hurting. Can't you see that?
I'm sorry, bud, but it happens. We can't do anything about it.
Actually,
Fix
there
me,
are some
Doc.
things we could do about it.
Like, what?
Like treatments and medical plans and stuff.
See?
Does that make you feel any better?
Just a little bit.
Okay.
Hey guys, docs! I need you to come over here. I need to talk to you guys.
What is it? What do you want?
Well,
your
I
blood
had
pressure
some
and heart
question.
rate.
I was wondering, like, how could this affect me any other way? Like, what are some signs and symptoms?
Well, some symptoms could be internal bleeding, so like in your abdominal region, in your airway, so like bleeding in your airway, or your central nervous system. Bleeding in your mouth, so when you bleed in your mouth. Gums, or even tooth loss. So blood in your urine, so like when you pee there's urine or blood in your urine. There could be problems with digestion, so digestive problems, and nosebleeds. Unexpected and long and frequent.
That sounds really nasty.
Other symptoms are joint pains and swelling. It frequently happens in the knees and the elbows. Sometimes it really hurts. There is heavy bleeding and bleeding for a long time from an incident or injury. That's when like something happens to you and it just starts bleeding randomly.
Oh
It just bleeds and bleeds and bleeds. And there's a delay of bleeding where you can get a cut and then it'll bleed maybe 2 days later and it'll just won't stop bleeding and you'll have to come back here.
You'll have to come to the hospital to
And
get us to help
then
you stop it.
there's large bruises. There's swelling under the skin and between muscles with fever. There's skin discoloration. And you get a lot of pain.
You guys are gonna give me nightmares for the rest of my life.
I'm sorry.
So, there's a cure for what I got, right, guys?
Well, one here is the treatment plan. That's where you can get therapy, which replaces the blood clotting factor. You may receive the treatment to stop bleeding or prevent bleeding from starting. Regular infusion of clotting factors several times a week reduces the risk of bleeding. You may get infusion at home. Your healthcare provider may also prescribe pain relievers. If internal bleeding has damaged joint, physical therapy, or in severe cases, joint replacement may restore fraction.
Check her vitals and see if she's good to go home.
That kind of scares me, that treatment plan. Do you guys got any others?
While there's prevention, you could avoid using aspirin. You could get vaccinated with your hepatitis B vaccine. You could also administer your factors 8 and 9 on a regular basis to help prevent joint damage. And also avoid mating with girls that are a carrier of hemophilia.
Well, am I supposed to know if they're a carrier or not? It's not like you're gonna go to them and ask them, hey, can I do you? But are you a carrier?
Well, you want them to come get checked.
You always want to be checked.
So I have to
and
get
know-
the girl checked before I can go out with her?
Not after you go out with her. You just have to get her.
You have to get checked before
So
you know.
complicating, guys.
I'm sorry.
Are his vitals good to let him go?
Yep, he's good to go.
Whoa! Good to go. I'm going, guys. I'm going. Goodbye.
So overall, I think you did well with this patient. I think you just need to brush up on your knowledge of the disorders that you're dealing with.
Like,
so that
what?
so that you know descriptions and how to help answer their questions, because I found that there were a couple of times when you were very unsure of yourself and had to ask me to help.
But I still did it. It's good. It's good. It's
you
good.
still did well. I will admit.
good.
Hey, guys. What's up?
What are you doing in here?
This is the
Can't you
staff-
read the sign?
This is
I don't know what you guys are
Staff
talking about.
only.
Staff
Staff
lounge.
only.
Hey, I got stuff I gotta tell you.
Like what?
The staff lounge.
Did you know that with each pregnancy, a woman
Oh,
who's
God.
a carrier has a 25% chance of having a son with hemophilia?
No, actually, I didn't know that.
I'm a doctor. Obviously, I knew that.
I feel smarter than you guys already.
But I knew that.
Well, did you know that Queen Victoria was a carrier of hemophilia and passed it on to her son? Oh, I just owned you.
Well, before 1938, the average lifespan of a person with hemophilia was only 11 years old. Now the average lifespan in a severe case is 63 and in a mild to moderate case is 75.
Did you know that?
Modern medicine has definitely
Yes,
come
I
a long
did know
way.
that.
No, you didn't.
Yes,
Guys.
I did.
It's just interesting facts. Calm down.
I'm sorry.
Oh my
Okay, it's your
goodness.
turn.
Did you know that 70% of all individuals with hemophilia A or B inherited the disorder? The other 30% have hemophilia because of a spontaneous genetic mutation.
Oh my
Like
God.
me, I'm spontaneous, guys.
Yes,
I did not know. Wait, Kate, wait. What are you doing in here? It's time to get out. Let's go.
Hey!
Out, out,
Hey!
out, 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 out.
I'm afraid, you guys.
He's awake. How are you feeling?
What happened? Where am I?
I'm Dr. Zabik. You're in the hospital, honey.
What happened? Where am I?
You're in the hospital. I'm Dr. Zabik. You fainted from uncontrollable bleeding.
But what happened? Like, how did I get here? Like,
This is called hemophilia. It's when your blood does not clot.
how did I get this?
Miss.
So, when am I gonna get out of your doc? You know, I got man things I gotta do. I got girlfriends I gotta see, kiss, you know.
You shouldn't be in here much longer. You should only have a few more days. We just want to look.
You did this to me! I could have blitzed it and died. All of you